Mr. Jones. My name is Stacy. I'll be your nurse today. I'm going to be doing a wound care on you, okay? I'm just going to set out my stuff real quick before we get started so I can get organized. How are you doing today? Are you doing okay? Alright. Alright, I'm going to wash my hands real good. Okay. Now I'm going to dry them. I'm going to put some do what?
Latexology, ask him before you put it in.
Yeah, I haven't got there yet. Okay. Alright, Mr. Jones. I'm going to be doing a wound care on you, okay? I want you to tell me your date of birth and your name. This is on that side. Let me come around this side. Because this bed is big. Okay. Say that he does have his. Okay, yes. He has identified himself. Okay. Are you allergic to any latex or any other medications? No. Okay, so we're good there. Are you in any pain today? And if he said yes, I would ask him, what is your pain scale? 0 being the least, 10 being the most worst, excruciating, you can't handle it. And he says no. And I'm like, okay. So I am not going to give you any pain medications right now, all right? So when I get ready to do your wound, just let me know if it hurts, okay? Okay. All right, here we go. Before we do that, okay, we got this open right now. I'm going to take this out. Why did they always have it down at the bottom? Oh, that's not even. Put my gloves on. Okay, here's my bag. And I've got the trash can right next to here. So I'm gonna open this up. Place this right here next to me. Alright, Mr. Jones, I've got this right here next to me. If you will just stay still, okay, and don't kick. Alright, and then I'm going to take this out. I'm going to place this on my table. Like that. Put down right here. Okay. I'm going to get all my these have. Okay. Take this out and I'm going to put this over again so it doesn't. I'm going to fold that real quick because I need to look at his wound. We're supposed to take it that we're only verbalizing. I don't see a wound. So we're going to just do it right here on the abdomen. Okay, he's vibrating. Alright, so say that he's got a wound right here, okay? Alright, Mr. Jones, I'm just going to look at your wound, okay? And I'm going to remove the top part of the wound deal off, so I threw it in there. I'm gonna put this okay, right here next to it. Keep it nice and clean. Alright. Then I'm gonna take this and I'm gonna dump it on my sterile. Okay. I'm gonna leave it all right there for right now. And then I'm gonna take my water and I'm gonna put it in here for my draining. Okay. And then I'm gonna take this out. And I'm gonna put it right here. And I'm gonna take this and I'm gonna throw it away. I'm just gonna put it right there for right now. Okay. And I'm gonna put this right here. Okay. And now I'm gonna take my sterile gloves and I'm gonna place it in here. And I'm gonna throw that away and I'm gonna hold on to it. And I'm gonna take this down. Yes, and I'm gonna get some gel. Okay, I don't have no gel here. So we're gonna,
You can
We're
put
just-
this one on the wall.
yeah, we're gonna verbalize that we have hand sanitizer. So I'm gonna wash my hands again. Okay, Mr. Jones, I'm just gonna put on some extra gloves here, okay? And I'm gonna open it up like I would, because it's sterile. And these aren't. Do that. Okay, I'm gonna put on my left gloves first. Okay, I'm gonna put on my right. Okay, and then I'm gonna discard this, but all right. So now I've got my sterile on. Okay. I'm gonna put these and I'm gonna open them. And then I'm gonna take this, I'm gonna place it right here. I'm gonna put these right here and I'm gonna put some extra ones in the water. So that way they can be in there. Okay. Okay. All right, I'm going to get ready to clean, all right, your area. I'm gonna take, I'm gonna put them in the water, okay? So I'm gonna start, he's got an incision that goes all the way down. So far, everything looks good. There's no redness, there's no drainage. It looks really good. So I'm gonna place this in the water and I'm gonna go down like so. Actually, no, that's in there, okay? So I'm gonna take this hand, I'm gonna take my gauze and I'm gonna wring it out, okay? I'm gonna place it on this one and then I'm going to clean around it. Okay, I'm going to toss it in. I'm going to reuse it, sorry. And then I'm going to take another one. I'm going to do it again, go around the site, okay? And then I'm going to toss it, but I'm not going to toss it because I need them. One toss. Okay, and now I'm going to take my dry. I'm going to place it here and I'm going to go down and I'm going to go down and I'm going to throw it away, okay? I'm going to keep it. So now that I've got it cleaned and it looks really good, I'm gonna take this. No, I'm gonna take this and I'm gonna put some saline solution in it, okay? And then I'm gonna take my bulb and I'm gonna squeeze, okay? I'm gonna put it in this hand, and then I'm gonna take my dry, I'll place it on this hand, and I'm gonna put it down below, and I'm just gonna go down the incision, just to kind of rinse it off, okay? All right. And I'm gonna throw that away, and I'm gonna put this back in there, okay? But I'm not gonna throw it away. And then I'm gonna take another one, and I'm gonna go down the sides and throw it away, okay? But I'm not, okay? So now I'm gonna take my swab and I'm gonna throw this way, or I'm gonna keep it, whichever way. I'm gonna pop this open, like so. Okay? I'm gonna take it, and I'm gonna go down, and I'm gonna get as much on here as I can. Okay? And now I'm gonna put it in with it. Okay? I'm gonna place it right here for right now. Okay? Now that we've done that, I'm gonna do it again, and I'm gonna clean again. This is wet. And I'm gonna go down the middle of it, okay? And toss it. I'm gonna do it again. I'm gonna go down the middle of it, and I'm gonna toss it, and then I'm gonna dry it. Okay? And then toss it, and I'm gonna dry it. I should have grabbed with my other hand put. Okay, so now I'm gonna take my ABD pen. Okay? And I'm gonna place it on top. Blue. Okay, just like that. I'm gonna take that away. And I should have had my tape ready to go. And I'm gonna tape right here. I'm gonna tape at the bottom, and then I'll tape the sides. How are you doing, Mr. Jones? You doing okay? Are you hurting? No? All right. Okay, so I've done that. I'm going to, so we did that, we did that. Okay, now I'm gonna take my gloves and I'm gonna throw them away. I'm just gonna get a new pair. Okay, then I'm gonna go to the wall. I'm gonna grab some hand sanitizer. I'm gonna wash my hands again. I'm gonna grab some different gloves. Pulling them out of the wall. All right. Okay, Mr. Jones. Just gonna put this back over, just like that. And place that in there. I'm gonna put this, and I'm gonna put his ID, his information on this. I'm gonna put it in here, and I'm gonna put it in a bag to send to lab, and everything else will be discarded like so, but I'm not going to discard it because I'm pretty sure we're going to use it again. So you didn't see this. Okay, all right, Mr. Jones, I will be coming back here a little bit later. Okay, I'm gonna take this, Get it ready to go, and I'm gonna tie it. I'm not gonna tie it because I'm gonna use it again. So I'm gonna discard my hands, and I'm gonna clean them again. All right, Mr. Jones, we are all done. Is there anything else that I need to get you? Okay, I'll be back in a little bit. And I'm gonna take all my stuff with me, and we are done.